Hey everybody, this is Tim Peck, Dr. Tim, here with Sarah Blessing, my co-star, and we are talking to you on Dr. Tim today about things like bird flu, a new pain medication to reduce opioid dependence on the market right now, and how I lived in a nursing home for 3 months. Dr. Tim is a show about bringing goodness to people's lives, talking about issues of the day in such a way that we can free people of the fear and hate that a lot of our local news media and really our national news media like to infuse in us. So that's what Project Next is all about, trying to do things a little bit differently here. So firstly, before we get into bird flu, how's your oatmeal diet going?
My oatmeal diet is going great. I ate it this morning.
Did you?
I was able to put butter. I add butter to it.
All right. So the number one clicked on thing of Dr. Tim has been our discussions on
Oatmeal.
oatmeal. So we'll
Oatmeal and the cruise ship virus.
cruise ship virus.
What is that thing called?
Norovirus.
Yes.
Norovirus.
We had people watching the episode saying we're in the hospital with it right now.
Yeah, I
So
didn't know
I guess
that.
they searched it and it came up. Yeah.
And
Yeah.
they learned about it. Wow.
Yeah. So cruise ship virus. Now we're going to talk the hot button bird flu. I don't know, but the media has been really pushing that we should be panicking about bird flu.
Yep.
I'm getting articles from family members sent about it, and I took my chat GTP and I was like, "Can you get it from eating the eggs?" And they were like, "No, as long as you cook it.
As long as you cook them," and we'll talk about that. Yeah,
because that was the big thing. I was like, "Well, do I need to be worried about this?" And I was like,
"It is in eggs, though. It's good to know that. But if you cook it, and it'll be fine." And we'll talk a little bit about why it's in eggs and why it goes away when you cook it. Bird flu is also called H5N1. It's an influenza strain, a flu strain, flu A, which is the common flu that we're all used to. But this is a flu that is primarily in birds. It also has been shown to be in mammals, ground mammals like raccoons, and now even humans. And here in the U.S., we've had, I believe it's up to just under 70 cases now, one death, and a very severe case just recently in Louisiana where someone was hospitalized. So it is something that is scary and can be talked about in a very scary way. And people are worried about it becoming the next big pandemic to go through the United States. I think the place where we should be concerned about it more than anywhere is in our livestock, and in our birds, and in our price of eggs. And we'll discuss how that's happening as well. So bird flu, the first time that bird flu was ever documented was in a flock, I believe, of ducks. It was some sort of fowl in Italy in the 1800s.
Wow.
So this has been around for a long time, everybody. This is not a brand new
Didn't know that.
Yeah, and so that was the first time it was in animals that it was documented. It's probably been in people before, around then too. And then in the late 1900s, just at the turn of last century, in the 80s, we saw it in humans. And then in 1997, we were both in high school. Yeah. 1997, there was a bird flu outbreak. It was the first outbreak in humans, and it was in Asia. Only a handful of people, but the first time it was in multiple people, so that was scary. And then kind of has been smoldering around, and now here in the United States, really started in 2022 to be seen in our livestock, and then in 2023, 24 to be in some humans in 24. So this is brand new in terms of the United States having it throughout.
So it's brand new having it in livestock in the U.S.
Yep.
and in people in the U.S.
It's even newer. So there's probably been cases of it before that we haven't had on surveillance, but now we're seeing it even more. So that's what it is. So it's a flu virus, and what it does is it gets into the lower respiratory tract, into our lungs and the lower part of our windpipe here. And the reason that's significant is that a lot of viruses, you have a big sore throat and other things. That's really easy to
So it spreads
Spreads very
easily,
easily.
sort of like COVID, where it's airborne.
Right, it's airborne there.
Okay.
It still could be airborne if you have a big deep cough here, or you get some, get that mucus out, or whatever it might be. But it's harder to go from person to person when it's down here. And the concern is that if it mutates to be up here,
Oh.
then it'll be
So
easier
it's
to go
so
around.
low, it is a little bit harder to spread, but if it mutates and comes,
That's right.
okay,
And
I didn't
because of
know any of
that
that.
and other things, we think that there's probably none of these 70 cases or so in the United States have been from human to human. They've only been from
Oh.
poultry to
Are
human.
these people that like have livestock in their yard and they're handling them?
It's both in their yard and in the more industrial farms.
Workforce?
And we're here in southern Indiana, and right here in Seymour, Indiana, we are home to Roseacre Farms, which is the second largest egg producing farm in the country,
Oh, I didn't know that.
right here in District 9 in southern Indiana. And they have multiple farms throughout Indiana, and one of them has had to cull and euthanize a lot of their chickens. The one
That's
they have
why
in.
egg prices are going up then.
So egg prices are going up. So egg prices have been going up. They've gone up 65%
Wow.
over the last year or so. In comparison to inflation over the last year or so, has been very low. It's been two and change. I think it's 2.6, 2.5% or so. And so the difference between 65% and 2.6 is enormous,
Right.
right? So
Yeah.
the cost of goods going up. And so eggs, and it's supposed to rise. Some people are saying 20, some 30, some say 100% more, depending on what happens here. So
Wow.
eggs are going to be
So
expensive.
you can still cook with eggs. You're not going to get bird flu from it, but cook the egg yolk all the way through.
That's right. So
And then you have chickens.
I do have chickens.
Is
I
this
do have
something you
chickens.
need to worry about?
Yep, look for your chickens to see if they are, if you have a dead chicken, don't go anywhere near it. Keep your animals away from it. And you should call your county public health office. That's where
Huh.
you should start. If you have a dead chicken, do not touch them right now. If you see a chicken that's lethargic, is very tired, is not eating, is looking sick in any way, do not touch it. Keep your dogs away from it. Keep your children away from it. Call the
Do
public
we
health
have
office.
cases in Indiana? Do we know?
We sure do.
We do have
We,
cases
sh-
in Indiana.
we
How's
sure.
Goldie?
Goldie is okay. Goldie
That's the
is
son's favorite chicken.
my son's favorite chicken. They have a relationship. Whenever my son approaches the coop, the Goldie comes out of the flock and goes
I
to.
want to make sure Goldie's okay. I
They're
like that
okay. They
chicken.
went for a sleigh ride
So
when
your
there was
chicken's okay,
snow.
but you're watching them. So you're
We are
looking and
watching
seeing, and
every
then
time
are you
before
just
we go
like
and feed them in the
hand
morning.
washing really well when you are with the chickens? Is that another
Afterwards, yeah,
thing?
for now. And so we collect the eggs in the morning, and then we'll bring them and wash our hands after that as well. After cleaning out the coop, we'll wash our hands as well and try
What
to do that
about
as much
people
as
with
possible.
bird feeders?
Bird feeders. So migratory birds, so like geese, and in geese droppings, it's been shown to be there. Ducks and geese in the wild is actually where its natural habitat is. That's where what they call the reservoir, the place where it just lives on a daily basis in a normal place. So it is in those types of fowl for the most part. I haven't heard or know of anything about,
Small
smaller
birds.
birds, but I wouldn't put it past it, but I just don't know. So we'll look that up as well if anyone in the comments knows. And then we have mammals too, small mammals, including house cats. It's been shown a couple of them to have it. So again, if you see a sick bird, just stay away from it. What is
Here's a good comment from Terry. She said, "Should we treat?" I'm having a lot of maybe I should just turn my phone off. Should we treat the bird flu like the common flu, like preventing it by washing hands? Oh my goodness! I'm gonna turn my phone off.
so preventing, yes, just washing hands is a large part of it. Making sure that disinfected surfaces after you used raw eggs, after you used fowl that you're cooking. is one way that we should make sure that we don't get it. Again, the chances of this are
So
super low.
small. So you're probably going to get the other things going around. Real flu, the stomach flu,
Noroviruses.
norovirus.
Yeah, those
You
are
have
much
more
more likely.
chances of getting those. Okay, let's say
And then
you
again,
do get bird flu. Can you tell us what the symptoms are? Because that's
it's
what.
going to feel like the flu. So it's going to feel like the flu, but you'll have had a history of playing with birds, touching birds, mammals that were with birds, and cows. Herds of cows right now, all throughout America, have bird flu in
Wow,
them. And so those whole herds have to be euthanized as
that's
well.
sad.
So that brings us to milk and unpasteurized milk.
Oh, okay.
Unpasteurized milk, there's a lot of talk about unpasteurized milk and should we have it, should we not? Some states have it legal, some states don't. What pasteurization means is when you take the milk and you disinfect it, you heat it to a certain heat temperature and do that for a long enough time that it kills all the viruses and bacteria and
And your
things in.
regular milk is that way. The
And your
regular milk you're
regular,
buying at the store
and so
is
you will not get
pasteurized.
bird flu from your pasteurized milk.
Okay, that's good.
It's good to know.
So,
And you also don't get bird flu necessarily from the milk coming from the cow, even if it's not pasteurized. So if something is having bacteria in it, or if it's having viruses in it of certain types, it's usually because it got contaminated in some way.
okay. So what about
Usually.
unpasteurized milk? I would guess you'd say don't drink it.
Do not drink it.
Yeah,
And so the
okay.
CDC says do not drink it. I will put an article that's really good from the CDC, just listing everything. It's one of these things where on the internet people will talk about why it's good for you or try to debunk different things that the science has shown about pasteurized milk. Everything, I in preparation for this over the last couple of weeks, I've been reading a lot about unpasteurized milk, and we'll actually have a big show on it.
Oh, that's good.
It's not safe for you.
So I would think the word pasteurized is what is confusing people. It might sound like you're doing something, putting chemicals or something into it, but all you're doing is
It's
heating it
heating
up
it.
and killing the bacteria in
Yeah,
it.
it
And that
was
sounds good to me.
it was done along by a guy named Louis Pasteur.
Oh, that's
Right?
funny.
So that's
So
why it's
it's his
called
last name.
pasteurized,
That's
right? And
funny.
he was the guy to invent it and really helped change the world with it. It's one of the more important inventions that we've ever had in terms of public health and keeping people
That's
free
neat.
of diseases.
Okay, so to sum up bird flu, we're not going to get it if we're not around animals. We should wash our
Yep.
hands. If you have animals or you work around animals, you should be watching them for signs that they're sick.
Hmm.
Egg prices are going to continue to go up probably.
They absolutely will go up, and they are
And
going
but
up,
you can still eat
and they
eggs
are
and drink
in it.
milk.
It is in eggs.
Right.
So do not lick your cookie batter,
Right. And
right?
wash your hands after you crack the eggs, I would assume.
That's right.
Yeah,
After you've
wash your hands with
handled
soap and
eggs,
water.
you do
Yeah.
that, right?
Yeah.
Cook the eggs thoroughly, normally as you
No
would.
runny yolk.
I mean, even then, getting it up to a certain temperature, but yeah, I would suggest over medium, not over easy, right?
Right.
So, get the virus out of there,
And
and
then if you get
it's
it,
very
it's like the flu. So it's probably going to hurt
yeah
the one,
shown
the
to show conjunctivitis or like red itchy eyes, and then lower respiratory tract infection for the most part.
so stay safe everybody, but I don't think we're going to be getting bird flu. It sounds like it's mostly hurting the poor animals, which
It
is
is, but
sad.
it's getting it is in some people, right? And so it's something that we do have to be cautious of.
Right.
I don't want to say don't be cautious of it, but you don't have to be overly fearful of it if we're doing the right things. The thing is how do we get rid of and we'll answer some of these questions.
Hey,
Questions of
Ethan.
this.
So wait, you can get sick because of over easy eggs.
Well, we need to cook our eggs right now. I'd be cooking your eggs
Just
thoroughly
because of bird flu.
as we learn more about this disease, as it's becoming much more prevalent. And right here in our area, in southern Indiana, there are eggs that are infected. And if you're getting backyard eggs and from your own poultry in some way, you're just watching out to make sure that those poultry aren't showing any signs of illness or one isn't dead. And if they are, report it to your public health, your county public health. It can happen through geese flying over and having
Oh,
droppings in there, small raccoons, other mammals. So if you're giving your food scraps to your chickens, which most people do to help them grow, and then a raccoon gets in there and eats, that piece of
oh.
fish that you put in there, that vegetable, whatever, that's how it could
I
spread.
was
So
wondering how like a chickens in your coop that are all contained are getting it, so it's other animals bringing it in.
that's right. And so the likelihood right now is not terribly high. So, but it's just something to be vigilant about and careful about, but not scared about.
Okay, so send us any bird flu related questions and maybe just comfort anybody that's nervous about it because they're definitely panicking about it on the media.
Yeah.
And I think it's nice that you research it and tell us the facts and the
Yeah.
truth so we can all just take a deep breath and calm down a little bit.
And Ethan, again, I love over easy eggs too, but for right now, as we're collecting it,
Right.
I mean, again, I told you the timeline, right? This hasn't really been in the U.S. since 2022 is really when this started. 2024 is really when it started with humans in the U.S. So it's very new, and so if you can just not eat your over easy eggs for a little bit and cook them a little bit more until we figure out what's going on here, please do.
Here's a question. Terry Lightning, thank you. Is Indiana, the US at large, at a higher risk of outbreaks due to the anti-science sentiments?
Well, anti-science sentiments are spreading throughout the world. I'll say that. And I don't know if there's a direct, it's one of these things of correlation versus causation. If you've ever heard that in science, right?
Mhm.
Making a true this is happening because of this takes a lot of study and a lot of
So
understanding.
we'll probably learn later after this is over.
Yeah. So the one thing I would say about the anti-science sentiments is the part about milk and the pasteurization of milk. Again, this amazing scientific thing that we've had, which is simply heating
Pasteurization, yeah,
milk.
heating up the milk.
That really has helped us is
Can
something that
I don't even know, can
we
you
should look
get
at.
unpasteurized milk in Indiana?
I don't know what the law is, but you sure can find it from
Huh,
local farmers and
interesting.
from local people giving it to one another. Yep.
So,
You're not
yeah,
going to get it in the grocery store, though.
yeah, and I would say having a good government that is tracking it and using science and
Yeah.
testing,
So,
milk, unpasteurized milk, testing eggs,
yeah. So that's a
all
huge
that
part.
stuff would be
So,
very important.
so that's a huge part. A lot of our current government this month has been about removing us from the WHO,
The World Health
the
Organization.
World Health Organization, which a large part of the World Health Organization uh, is about surveilling various animals and various crops, etc. The state of Indiana has done a pretty good job working with Roseacre Farms. Roseacre Farms itself has a ton of its own self-policing in
That's
place
good.
where they test the birds. Right now, there's as of a couple days ago, there hasn't been any more virus there, but they're very much testing it, and have a protocol for cleaning their trucks, for cleaning their facilities,
Good.
etc. And they've always had that, and they've been very careful. So we have that in our backyard doing some of the gold standard. But the CDC is a huge piece, and if we remove funding for the CDC, they're the
Yeah,
people here that are really
we need
testing
that.
on a normal basis to make sure. They just found actually zoonotic, which is a word to mean another animal type virus that could be transmitted to perhaps to humans um, in some shrews that can affect people as well. The CDC found that, and they find these things all the time. We don't usually hear about them, and they do a little work to keep them tamped down.
Oh yeah.
Right? It's just happening all the time, the surveillance. So if we remove that surveillance, we're asking for it.
More people are going to get sick, diseases are going to spread
We're asking
quickly.
for it. We're
Right.
asking for it.
So yeah, I think I get kind of tired of the narrative of how much damage the national government can do and state government. They just, and it's like we don't see so much of the things that they are doing to help keep us safe
Hmm.
because I guess it's boring. But there are a lot of agencies put in place to protect us, and this would
Right.
be a big one.
That would be a big
And
one.
then Ethan, who is a lawyer, look, he said stores cannot sell it, but small businesses and farms can sell directly to consumers. So
Okay.
don't we recommend not buying unpasteurized milk from any place.
Ethan, if you could post a link to that law, that would be cool. If
Thanks,
not,
Ethan.
we'll look it up
Okay,
afterwards.
let's move on to pain meds.
Okay.
I
Yeah.
did not know there was new pain meds.
So a brand new pain med has come out, and we've been searching for this for a long time. When it comes to controlling your pain, we have acute pain. So there's acute pain and chronic pain. Chronic pain is I have pain
You
all
have
the
it all the
time.
time.
There's acute pain. It hurts right now. I need to fix it. And so when it comes to acute pain, we've really had two options for a long time. One is ibuprofen and Tylenol, and then opioids like oxycodone or hydrocodone or hydromorphone or
And we've seen a lot
morphine
of bad
or
things about.
fentanyl, and all these things that are opioids. All right.
Right.
The gap in between the effectiveness and how strong these medications are, as well as the addiction potential of them, is so enormous. And we've been looking for something in the middle for a long time, or a replacement to
Oh yeah,
opioids
definitely.
in some way. And we lose 100,000 people a year to opioid addiction. And this, we a lot of the fentanyl, which is the opioid that is going around right now, addiction and overdoses that we have right now are tied to border control to China, mostly coming through Mexico, and Mexico giving over fentanyl and synthetic fentanyl. But was all started with an American company making an American drug called oxycodone, which is an opioid that we fell for. And when I was trained to be a doctor, they told us it was free of addiction potential,
Oh wow.
you know, and
So many people have been hurt by this.
so many people have been hurt. And we were giving that drug, and we're saying, this doesn't seem to be, people are like coming in, lying, cheating, whatever,
Yes,
to try to get
sometimes they're
more of it.
hurting themselves, right? They hurt themselves to get the pain meds. They're
And
so
they
addicted.
would hop from hospital to hospital
So
trying to find
sad.
news, and you can blame the person, which originally that's what we're doing, we're blaming the
Oh
people,
yeah,
but
the
we now
stigma.
know
Right.
it's so super addictive that it's just simply overcoming it with the strength of your mind is up next to impossible. This is not an addiction
I
like
mean, we have
that you can just get
good
over.
friends that have lost children this way.
Hmm.
I was just talking to a friend of mine, and one of her close friends lost her daughter that way.
Yeah.
Um,
Yeah, I've done some interviews, which we should republish a bit around, with one of our friends who lost his son this way tragically. And it's something that affects our communities every day. So the search for a pain medication
so there's something
replacement,
out.
there is something out
Is it?
right
It's
now.
already passed through the FDA.
It is. It's called Suzatrigine. I mean, I haven't even.
Suzatrigine.
Yes, I haven't even like prescribed it. I haven't, it's brand new.
Wow,
So
I've never heard of it.
it's 250 milligram
Is it
pills a
expensive?
day. They're charging $30 a day for a dose right now. That's unclear how insurance or Medicare, etc., are going to handle it one way or another, but they should cover this medication, it seems. So I want to say two things about one of it. It doesn't work like an opioid in any way. Opioids work in the brain and the spinal cord to what are called opioid receptors, and they stick onto that, and that's why they're so addictive, because once it's off, your brain just wants to stick back onto
Oh,
it.
okay.
So it's to the central part of your nervous system saying, don't feel that pain. It doesn't actually stop the pain.
Your just brain is getting tricked to not feeling the
Don't feel
pain.
that pain.
Okay.
And so your brain, your spinal cord say like, you don't need to feel this. This works on the peripheral nerves, the nerves that if you hurt your finger, the nerve right here is where it's going to
The
work.
new medicine
Hmm.
goes to the area that's hurt.
Yeah, and the actual nerve that's getting
Oh,
there, and
wow.
it works on the sodium channels of the nerve, the pain nerve, the nerves that make
Sodium.
you feel pain, and it really dampens it down.
Oh,
And so
that seems better to me.
it does seem better. And I want to talk about what the study shows, as well as just a little word of caution as we move forward with it.
Yeah, I
Because
mean,
the
because
excitement
right,
is enormous around
right.
this in the medical community. And soon you'll see it in the news, etc. And the excitement will be there. right? I'm excited about it, very excited
Well,
about it, but
I'm
we've been
nervous
fooled
since
before.
you were told that opioids weren't addictive. That makes me nervous.
Right.
Yeah.
So, I think it's trust but verify, and we need to, and we can't get fooled again.
Right.
We have a lot more surveillance. We have these programs where once you take a pain medication, an opioid pain medication, you go into a system so that we can make sure you're not pharmacy hopping or doctor hopping
Right.
for them. All these other things that we've put in place because of the opioid epidemic. I hope that we use a lot of those tools to make sure that we can track this and make sure it's not as addictive,
Right.
not
Right.
addictive.
Right.
The science shows, like the laboratory science shows, it shouldn't be addictive, but uh, we've been fooled before,
And
right?
then
That's what I
let's
want
say
to say.
this medicine does work. People are not everybody's going to have access to it because it's too expensive.
Yeah, thirty
Um,
dollars a day. It's for acute pain, so be like $30 a day for 3 or 5 days.
so maybe
If you
if you
had
were in a
a
bunch of pain.
broken bone and you
So this is
have addiction problems, etc., you know, scrounge up the money from a GoFundMe to get it, like whatever
right.
you need,
Right.
because or deal with the pain and take ibuprofen and Tylenol. Those are your options right
Right.
now. So hopefully, as more competition comes out too for
Right.
other drugs, because other people
It'll
are
be
looking into
similar.
it, they're
Yeah.
similar, looking at a little bit different mechanism, but similar. It'll help drop it a bit. It's nowhere near going to be generic for many, many years, decades. And so, yeah, the price will be, but
But
still,
you
$30
said it's
a
for
day is not,
acute pain, so it's not something to take for chronic.
you can't
So
take
you
it every
can't
day.
take it chronic for
However,
like your
there's a
back
study
pain or
going
whatever.
on for chronic pain. So for what's called diabetic neuropathy. So when you have diabetes, you can have pain from your nerves
Mm.
hurting you, and then those nerves go numb. But you the study for the acute pain did it on tummy tucks and bunion surgery. Bunion surgery is really painful.
Oh wow.
Yeah, it's like one
We
of the
should
more.
talk. I've had a tummy tuck. We
Have
should
you?
talk about it sometime.
All right.
It's
So,
pretty interesting.
and so the pain from that and the pain from that's what they did it on. And it showed is that they did placebo, which means just giving a
A
pill that
fake
has
pill.
nothing in it.
Hmm.
They did opioids, and then they did this new drug, which is suzatrigine. Suzatrigine. Um,
Sounds
and
like Susie tried. Susie
Susie
tried.
tried. That's how we can remember it. Suzatrigine. And they did all three of those, and what it showed is that the opioids were better than the placebo, that the suzatrigine was better than the placebo, and the opioids and suzatrigine were about the same. They did about the same job of getting the pain down after
so
that.
so that's
But one
good.
is less addictive.
Right. So it
Everything
could
shows
be
it's
good
addictive.
news.
It's good.
Especially want to make sure
It's
that
good news.
it's
It's
not
good news.
addicting.
But we just need to make sure as a society that we don't get fooled about this or anything that a pharma
I
company
was
is
gonna say
telling us
big
what,
pharma really pushes out a new drug.
and gives money to our politicians to give them cover,
Right, right.
right? And
I
so,
heard like cheerleaders and stuff get recruited for these type jobs. Have you heard that?
oh, for sure,
They're
1000%.
like really like
Yeah, you have
attractive,
attractive, bubbly,
personable,
30,
bubbly,
not just
coming to the
cheerleaders, but
hospitals and
yeah,
just like
males and
pushing the
females.
new medicine out. Yeah, yeah, yeah.
Yeah, yeah.
Yeah.
It's generally who you have as salespeople for drugs, and they get paid very well when they're good
When
at
they're
that.
good at it.
Yeah,
So everybody has to
premier
be
sales job.
vigilant to people are trying to make money.
Yep,
Let's
people
keep
know the
everybody
agenda, right?
safe. Yeah, yeah, yeah. Okay. Well,
Part of it is the incentive is to make money here for
I
the
think we should wait a
companies.
little while for more info to come out. We should talk about this again because this is
Yeah,
interesting.
we'll bring it up a number of times as it starts. It just came out like this month.
Wow.
Mhm,
Well, I did not know about
mhm.
that.
And there are other drugs out there being developed, and some even more cutting edge technologies. So it's a big breakthrough for us. Whether it's addictive or not, it's a big breakthrough, and it looks like it's not addictive.
Okay, that's interesting. Thanks.
Yeah.
Okay, I want to talk about Tim. You do not brag about yourself ever. Every once in a while, I'll just hear something really interesting about you, and I'm like, what? And this is one of them. Did you know that Tim Peck lived in a nursing home for 3 months?
Yeah. So.
And
Mhm.
most people don't do that. And it was really hard. There's an article that I'll post in the notes. it was really hard just to find a nursing home willing to do this.
Yeah, had to
Okay, so tell us,
look at thousands.
why did you want to live in a nursing home,
Yeah.
and tell us all about it, because this is fascinating.
Yeah, so I'm an emergency medicine doctor. And as an emergency medicine doctor, you get patients coming from nursing homes all the time. And in fact, we know that 19% of the ambulances that come to a hospital, 19%, 1 out of 5 of those ambulances has someone in that ambulance from a nursing home.
Oh, wow.
So it is just millions of people being transferred back and forth every year, to the from the nursing home to the hospital, and it's a terrible experience. These are older patients. We know that 53% of them have dementia of some sort, and when you have dementia or you're older and you get a fever or you have pain or the lights and sirens, the change of day and night, whatever it is, you tend to get delirium. Delirium is confusion. It's not dementia, right? It's something that's temporary. And when you have delirium, most people who have delirium when they're older, when if you had delirium because you had a 105 fever or you were on amphetamines,
I'd like come down and be okay. Like,
well, you would, but also you'd be flailing around and
right.
crazy,
Oh,
right?
so
And
you
you'd
can
be
injure yourself.
hallucinating and you're
Okay, yeah, yeah,
but
yeah.
if you're older, you don't do that. You actually have something what's called quiet delirium. You become internally preoccupied.
Yeah.
And because of that, you look like a shell of yourself. You don't talk. You don't express yourself. And these people who come to the emergency department look completely different than they did 2 days ago and are not advocating for themselves, etc. And it's very rare that the family is with them when they come to the emergency department originally because they came right from
So
the
then it's
hospital.
going to be really hard for a doctor and nurses to figure out what's wrong with them. They've
Right.
kind of shut down. They're
That's
not
right.
telling you. And
So
then
we do what's called Order the Rainbow,
oh yeah, so you're
which
testing
is we
everything.
literally do everything.
I've seen this with my grandma. She passed away 10 years ago, but she would get a UTI at the
Mhm.
nursing home, and she would be sent to the doctor, and I'd go visit her at the doctor, and she wouldn't be making any sense,
That's right.
and she'd be like mean to the nurses, and my
Mhm.
grandma's the most loving person
That's
ever,
right.
like, so completely different personality, and then it would just take forever to recover. I
Hmm.
mean, the trip to the hospital was so harmful on her.
Right.
And it was just a UTI where she could get antibiotics,
That's
do
right.
a simple urine
Yep.
test, and
And
yeah.
when you're in at that age, UTIs can become deadly very
Right,
quickly.
right, right, right.
You become septic and get bacteria in your blood very quickly. So you need to treat people. But one of the most common symptoms and presenting symptoms, meaning first symptom that you see as a clinician, is delirium and mood
I
changes.
bet a lot of you listening have seen that with loved ones when they go to the hospital.
Yeah. And so I was receiving these patients and saying, the paperwork that comes over is really poor. You don't have great communication between the nursing home and the emergency department. And what people do is they point fingers. And I was
So they're
guilty of
all
this.
blaming it
I
each
say,
other.
why isn't the nursing home sending over this patient? I don't even
Right.
know what's wrong with them. How did they get so bad, etc. And I later learned that the people in the nursing home are pointing fingers at the emergency department. Why is the emergency department, making these people worse? They go to the emergency department and then they get worse, right? They get admitted to the hospital, even though I asked for them to come back to the nursing home so I can treat them there. And like we lose control over them, and then they miss their Parkinson's meds, and you miss one dose of Parkinson's meds, and all of a sudden yours
Oh
changes
yeah.
everything.
I have friends that's parents that's happened to them. They can't get the right meds when they're in the hospital. It takes
Right.
forever.
It's just
Yeah.
it's not good for anybody. It's
Right.
not good for the doctor treating this. It's terrible. You feel terrible doing the treating
Yeah.
patients like this,
Yeah. And then
right?
seeing them decline and you can't fix it.
It's not good for the nurses.
Right.
It's not good for the patients. It's not good for the families. It's not good for the healthcare system and the money that we spend.
And saying how expensive this not great care is costing everybody.
Yeah.
Yeah.
And so I was looking at this, looking into the data, and CMS, the Medicare Medicaid branch of government, was looking at it, said 45% of these hospitalizations should be avoidable based off
Wow.
just looking at the diagnoses, saying you could treat these diagnoses in the nursing home.
Right.
You don't need to treat them here
Right.
in the hospital or
Keep
admit
them
them.
keep them in their safe place where they
Yeah. And
know
that
what's going on.
equals, on two different estimates, between 20 and $40 billion being spent that we don't need to spend
Wow.
in the United States. So talk about Doge and cutting costs. Let's look at things in healthcare
So
where we need to
so
cut
you
costs.
wanted to go and stay at a nursing home and figure out telehealth.
Yeah, I wanted to figure out how we can stop this,
Okay.
how we can stop this.
Right.
And I thought telehealth would be a good solution. This is back in 2011,
Wow.
when we did the actual living in the nursing home, started in 2015. And it was early into the,
This is before we were zooming all the time.
yeah,
Yeah, yeah.
2011, we barely had FaceTime.
Right. It seems
We
so
weren't
long
using FaceTime.
ago.
Right. And so, um, people we had FaceTime, but people weren't using it right at that time. And so, and only, only 1% of doctors even knew what telemedicine was at that time, right? It just wasn't a thing. And so, but we said, okay, this could be great. We could reach people at the moment of their emergency, at the moment they're getting sick in the nursing home, be able to bring a doctor into the nursing home. Nursing homes don't have doctors. Most people don't know that.
Huh.
It's a nursing home, not a doctor home, right? It's not a medical home, it's a nursing home, where so there's great nurses there who are really caring,
But there's
etc.,
not doctors.
but there's not doctors. And so what has to happen is you need to be transferred for doctors. There's also not a lot of testing going on in a timely manner, right? If you need an x-ray, sometimes the x-ray can come to the nursing home, but most of the time the patient has to go out to get testing, if it's more advanced testing. And so you have to send the patient to the hospital for that. And then nurses are overworked. We have a nursing shortage in this country, and nursing homes have a 36-to-1 ratio of
Wow.
nurses
I did
to
not know it
patients.
was that high.
Right. And because these are our most disabled, most patients who need the most chronic needs,
36 to
but when they're acutely ill, changes everything because now you need a lot more attention than the nurse can give you. And so what I did is eventually I lived in a nursing home to understand everything I could. I lived in a bed of the nursing home and eventually set up a shop in a conference room in this nursing home,
Yes.
and created a company out of that, created new technology, new nursing home technology. And the first person that I ever saw, his name was Mr. D. I don't think I've ever told you about him. So Mr. D, we saw on July 15th, 2015. He was the first person in a nursing home to see. We had tested his technology, seen people in other less severe places, and that's where it was. We were supposed to start the next day, but the medical director of the nursing home, who doesn't work there, he works in the community,
Okay.
right? Doctors work in the community and then they go and visit their patients in
Right.
the nursing home. And so, the medical director was there. He's like, let's do a test run. I have this patient. We're being told by the nurses that he has some vague abdominal kind of distension, and he gets constipated a lot. And we're going to give him an enema, and put him back to bed. He's really safe patient. He'll be a good person to go test and
Uh-huh.
make sure everything's working.
Okay.
And so we have the phone there, seeing Mr. D. He's looking to a gruff guy. He was like, uh, I believe he's a plumber, and Mr. D, had like pinups on his wall and things. Like that's the kind of guy he was. Everybody loved him. He knew everybody, and he's there saying, "Oh, I'm fine. I'm fine." And I could see because our technology was integrated with the electronic medical record system that he was diabetic, and I could see
That's
that
good.
he was a little bit short of breath. And we put telemetry on him, the thing that shows
Oh,
the
okay.
right and onto him, and we could see that his oxygen numbers were a little bit low, and his breathing was a little bit high.
So when you're having this meeting, is there a nurse in there?
The nurse
And
is
the
in
nurse
there,
is doing the things you're saying, test this, and then the nurse is testing, and then you're seeing right there what the results
and
are.
then our program had a paramedic come to the bedside for sick people because 36-to-1, you're not going to have a nurse if with this patient at all
Right.
times. And so we had a paramedic there as well, helping along the way. And someone who is, which is now called community paramedicine, where you use a paramedic in the community rather than just on the back of an ambulance. But this is early. And so that's what we're doing. And diabetes plus vague abdominal pain plus shortness of breath means heart attack until proven otherwise.
Oh, wow.
And you wouldn't necessarily know that unless you're a doctor, right? And there it was. And so we did an EKG. Again, nursing homes don't have EKGs readily available. Most, when I say nursing homes, I mean 98% of them don't have an EKG readily available or anyone to read it right away.
Oh, right.
So they do the EKG, it comes up on my screen. with the technology that we have, we see, yeah, he is having a heart attack.
Oh, wow.
And so call 911, and I get to, as a doctor, talk to the EMS who comes to the bedside from to pick the Mr. D up. We put an IV in him, so that gave him an aspirin. Aspirin really saves lives in this situation
Mhm.
with heart attacks. It helps thin the blood so that the heart gets more blood to keep it alive. And we, he went off to the hospital. I got to call Charlie, his son, and say, "Hey, your dad's going to the hospital." Told him what's up, and he actually met him there right
Oh,
away and was able
wow.
to work with the doctors. The doctors in the hospital, the paperwork that we brought, that we give to the ambulance and the EMS, they hand it to the doctors in the emergency department, and my number is at the top of it, so they can call me, and we could do a doctor-to-doctor conversation. This is a markedly better
So,
experience, right?
yes, it sounds better.
This is the first
The
patient
first
we
patient you
ever
ever did.
see.
That's
I'm like,
that's
everything's working. This
amazing.
is amazing. And so Mr. D survived.
Oh, great.
His lungs started filling up with fluid. They put him on a breathing mask to help with that. Never had to be intubated,
Oh,
like
good.
or anything, and left the hospital 3 days later with about 5% less of his heart function,
Huh.
which is
That,
barely anything.
oh, that's great.
And I have this great video. Maybe we can share it, um, where is Mr. D's in his hospital. I visit him in the hospital, and he's like, "This program saved my life."
That's
And
amazing.
like in that moment, I was like, I just changed the world. Like the world is the world has changed. Like we are able to show that we can save people's lives. And if he, in the normal situation, he would have gotten an enema. That's what always happened. That was his normal thing when he was feeling
That
like
would have
this.
not have fixed the heart attack.
He wouldn't have woken up in the morning, right? His lungs
Oh,
would
wow.
have filled up with fluid,
That
and
is
he
amazing.
would have died. And we did that thousands of times, covered 5,000 beds across the country with the company that we made. It's called Call Nine. What happened with Call Nine is that was brought me to DC
Right.
because we were saving people's lives and we were saving tons of money for Medicare. $20,000 every time we stopped a
Wow.
hospitalization, because there were a lot of patients that we didn't send to the
Right.
hospital because we got to them for their UTI and treated them
Right.
there rather than going there.
Right.
And so saved so much money that we were working with insurance companies and doing this new way of getting paid through these new, we had to invent new contracts to do what's called shared savings. Every time we saved them money, we would get paid,
Oh, yep.
rather
Makes
than
sense.
every patient we saw, we got paid. Because that's all I talk about, which is change the incentive
Change the
to
incentives to
allow me to
reward people for better care.
better care,
Right.
saving money, spending time with the patient. That's what we need, right? And it brings better care, better experience. And so we were making these new contracts, and then we were working with Congress, and I was working with Congress, testifying before Congress, working with hundreds of Congress people and senators to build a bill called the Rush Act, Reducing Unnecessary Seniors Hospitalizations Act. It was introduced into Congress, and then government shut down in 2019 for the longest time in history, and it was torpedoed. That didn't go through.
Oh, I didn't know that.
It was all ready to go through.
That is so sad.
And in 2019, it didn't happen. Bryce says value-based care. That's what that's called. This new way of doing
Thanks, Bryce.
this new way of doing care and paying for care. And so it shut down. It just wasn't able to do it. And I had to shut down the company at that time.
Oh, that's so
So we were
sad.
depending on the
Oh,
funding from Medicare. People started dying, right? We were saving people's lives. Now we weren't.
you're like, take it away. This program's working great. It's saving money, saving people's lives, and then it
And
just
I was
stops.
like,
Oh, it must have felt
what just
awful.
happened? It was
Must have
a
felt so
bipartisan
bad.
bill. It was introduced by a Republican,
Oh,
and we had Democrats, and then we had from all the important committees, Democrats and Republicans on the bill, introducing it. Lots of co-sponsors.
oh, it sounds so wonderful. Bipartisan
It was amazing. And
working.
then in 2019, just got just the worst
I did
it's
not
ever
know
been,
that.
and just stopped working. And in 2020, the pandemic hit. And if that were in place, it would have been tremendous, because we would have been able to grow the program, not just ourselves, but other companies across the United States. And
Right.
we would have been in nursing homes. Instead, we had hundreds of thousands of people die, nurses die. Nursing homes is where we talked about the reservoir of ducks and fowl being the place where a virus
Oh
stays,
yeah,
and
I
and
remember that, how
the
bad it
nursing
was in
homes
the
were the
nursing
rest
homes.
were the place where it would just stay, and it was
That
terrible
was
for
so
people,
sad.
and so many people were hurt, and nurses were hurt as well, and died. And so, if Congress could actually just get out of their own way and work together, we would have had that program in place. And that hurts me every day to think about it.
I sort of feel like you should maybe run for Congress and try to help with this. I don't know.
So healthcare reform is certainly what we're doing, and I wrote a book about it, right? So we're getting that book published right now. So
Yeah, that's exciting. I just want to thank you for all the work you're doing to try to help people. You're not only you're trying to save money, but you're looking at our most vulnerable people in
mhm,
these nursing homes and trying to give them better care,
mhm.
saving their lives. I have a question for you. What was like the thing you didn't expect to learn with living in a nursing home? Like, I'm sure it
Yeah,
was more emotional than just being a doctor and going and visiting patients for a few minutes and then
yeah,
you're done. You're staying there
definitely.
every day.
Definitely. I mean, it's lonely. It's a lonely time for people. It's a
Yes.
lonely time for people. And even when people had family coming all the time and being there, there's still long periods of time where people are lonely. One thing I did was this experiment where I woke up at like 1 o'clock in the morning, 2 o'clock in the morning, 3 o'clock in the morning, 4 o'clock in the morning, different nights, and walked around the facility to see,
What it was
what
like
it
at
was
each
like in
time
those
hour.
different times and what was going on. And somewhere around like 5:30 or so, I all of a sudden was down there and it was in the lobby and there were just people sleeping everywhere in the lobby. Like, what is
Are
happening
they
here?
just walking, sleepwalking?
No, it wasn't. It was nurses. And the reason it was nurses and nurses aides mostly. And the reason is because, it talked to them. They were getting off their other job, their overnight job, coming there, getting as much sleep as they can. There were people in their cars sleeping, getting a few hours of sleep before they started their other job, their day job. And this is the life of the working class person, the working person in the United States. And it's only going to get worse right now. And it is getting worse as the divide gets bigger. This is how hard it is, right? These are the people who are caring for us so much and they get paid
And so
not
their
nearly
job is
enough.
already really hard. That is a
Yeah.
hard job. They don't have enough of them, and it's not even their only job.
Yeah.
Wow. I did
So
not
and
realize
so
that.
that was just an eye opener for me to see how hard, and a lot of those people are immigrants um, to our country. It's something like 25-30% of nurses and nurses aides
Wow.
are immigrants that we depend on to do this work. And a lot of people supporting their families back home as well, working as hard as they possibly can. Um, so that was uh, a wake up call for me about how hard people are working and how we don't treat nurses the way they need to be treated. And I have some solutions for that legislatively too, which is nurses should be right now, nurses are seen as a cost. We should see them as something that drives value and pay. The better the nursing is, the more a hospital should be paid. Right now,
Oh, yeah.
doesn't matter how good the nursing is, the hospital doesn't get paid more.
Yeah, it makes so much sense to change it that way. Reward hospitals for treating nurses well, for nurses doing a good job, and then hopefully those are the only jobs for them.
Yeah.
Yeah, that makes a lot of sense.
So more on nursing homes, more on all of that, on Call 9,
You
on
know,
telemedicine,
I wish we did this.
as we go to other Dr. Tim shows. But yeah,
My favorite stories, and I wish we did more of this. Have you seen the sweet stories where sometimes they'll do they'll go in and film a nursing home that's let a preschool run
yep,
there,
yep.
and then
Started in Scandinavia,
they're
actually.
like reading, the kids are slow reading books to the
Yep.
seniors, and the seniors are so patient and loving it. And then I've also seen wonderful ones where they have like animal shelter. They'll
Hmm.
have like dogs and cats where they'll all be snuggling cats and stuff,
Yeah.
and these are cats that would just be in cages and possibly put to sleep, and so
Yeah.
um
Yeah. I
I
think that's
wish
a
we
lot about
did
the
more.
loneliness,
I
isolation.
wish we did more on helping them with loneliness.
A lot of nursing homes have dogs that walk around. Um, they're part of the community,
Yeah, I like
actually.
that.
Yeah.
I like
Yeah.
that. I wish we incentivized that more, and like how much like your preschool kid wants attention.
Yeah.
and how great seniors are at giving them
That's right.
attention. I just think if we could work that out so it would be more of a thing.
Absolutely. I mean, there's a program, a Scandinavian country, I can't recall which one, I think it's Denmark, where kindergartens are being built on the same buildings as retirement homes. So,
That's nice.
yeah.
Yeah. Loneliness is a problem that's happening in every age group in around the world right now. It's a big problem. I think it's one of the reasons why we're so divided because of social media and all of the stuff. And anyway,
Yeah.
I
Yep.
I
Loneliness,
think
isolation.
loneliness is a big issue
We
that,
talk a lot about, and we'll have an episode,
but it breaks
and
my
also
heart.
keep bringing back into it. But it's an enormous problem, and it's connected to gun violence. It's connected to school violence and school shootings. It's connected to
Suicides,
suicide
yes.
rates, opioid use, and substance abuse, suicide rates, and substance abuse in general. So it's a epidemic in our country, and something that there are solutions for, and that people are working on. But as legislators, it's something that legislators are responsible for working together to actually make solutions.
Yeah. Do you want to answer the couple questions or comments we had?
Sure, I'll answer the
Let's
questions.
see.
And then
This one
we'll
is
wrap up.
about the bird flu one. From Terry. With research and funding being paused in the US, are there any other agencies that you can look for guidance for the bird flu and health topics in general?
Yeah, it's state. It's going to be state, and so your state Department of Health is going to have a lot on their shoulders to be able to look at this when it comes to bird flu, and working with our egg producers, because we have the second largest egg producer in the country here, and others. It's the state Department of Health that's actually working with them.
I've worked with the state Department of Health when I helped with COVID shots, and those people seem to be really wonderful. I really like working with them. They just seem to have like a big heart that want to help.
Yeah.
So
It's
if you have
gonna
a
be more
question,
on their shoulders than ever before.
so you have a question about bird flu, call whatever state health department
Yeah,
and
or
ask.
I would call your county.
Call their county health
There's-
department.
And the way the health kind of system works, they'll put it up. If you call the state, you call the state. That's fine. But your county will be able to respond pretty more locally to you.
That's interesting.
Should you see a
Good question, Terry. Thank
Yeah.
you. And then Ethan looked up that information about unpasteurized milk. He said, so it is on Indiana Board of Health as far as it's not supposed to be for human consumption. That's unpasteurized milk. But if it's bought for animals or to be pasteurized, it's okay. It has to be in bulk. But I've heard people buying it in bulk to use for human consumption, even though it's not supposed to be. And then there's the website if you want to click on it.
Okay, I'll look more into that too.
Thanks, Ethan.
Appreciate that. Yeah, and Laura, thanks as always for doing the work, and everybody who works in healthcare.
Thank you to nurses. Thank you so much to everybody.
The system needs to change to make your experience better as well. The end user, meaning you, the healthcare provider, the patient, the family, the people who are doing the billing, the people who are doing the coding, like all of these people out there deserve a better experience. And there are ways to make changes to do that, that are obvious. And, as we go through Dr. Tim, we'll talk all about them.
Oh, and then Ethan asked if this, I don't know if we know that. Is this the drug?
Yes.
The Juranovex?
That's the
Juranac?
trade
I don't know how
name.
to say it.
I don't Jurnavix. I have no
And
idea.
what is it?
Yeah.
Susan, what's the name of it? I've lost it.
Yeah, it's
The new pain medicine.
now you get it. You got me. It's suzatrigine.
Oh, good job.
you.
This
Thank
is
you.
why you're the doctor and not me.
It's brand new.
So it is that drug. Okay, that's interesting.
Mhm.
Thanks everybody. We're gonna have another episode soon. If you have any things you really want us to talk about from a doctor, if the media is alerting you and giving you anxiety about a certain issue, let us know. Get on Project Next, any type of media thing that we're on. We're on Facebook and YouTube and Twitch and Instagram and TikTok, and message us and we will look into it. Maybe we can have it as a topic on the show. We also are a brand new media company, independent media company, and we are looking for support. If you'd like to help us purchase equipment and pay for our content creators, we have a place you can go. You can go to patreon.com/project next, and you can support us and then get a gift for your support. So you can do all the way from like $10 and your gift is a Project Next sticker, all the way up to $200 and you get a cool Project Next hoodie.
Yeah.
Oh, and show us your shirt.
HeyElmer.com.
HeyElmer.com slash, oh, I said it wrong. HeyElmer.com/Project Next. And here's Tim's shirt. He's finally getting it. It comes in gold, green, and black. So thanks for those of you that did support us, and we will see you soon. And take us out, and I'll put thanks to my husband and the band 1443 for the music.
Yeah. And here's the new theme song
for Dr. Tim.
Here it is.
Yep, it's called Awake, which works for, I think, a doctor who should be awake.
All right.
Thanks, everybody, and have a wonderful, wonderful day. Please share on wherever you're watching this so more people can see it, because we are brand new and we are growing.
Awesome. Thanks, everybody.